Hi everyone, it's Dr Sam here. We were recently made aware of a horrible case of a French Bulldog who was found dead in the owner's apartments when they came back home from work, and the owners attribute this to them suffering with Brachycephalic Airway syndrome. Why these dogs are prone to getting this condition is you've got all the anatomy in the schnoz, the snout of the dog, squished backwards, and you've got it all condensed into a very small area. This makes it really difficult for French Bulldogs, pugs and other brachycephalic breeds to cool down, but also to move air. And the risk is so much greater on hot and stuffy days, or even just stuffy apartments where the doors are kept closed without any air cons or fan on. So there's a number of anatomical problems that these guys have that make them prone to it. A collapsing trachea can also lead to it. Elongated soft palate, stenotic nares, that just is a fancy name for really thin nostrils, and a couple of other anatomical problems. Thankfully, we can correct a lot of those anatomical problems through a procedure that aims to really open up the airways and reduce the chance of a devastating situation like what happened to one of our patients just recently. And at Southern Cross Vet, we go beyond the 5 out of 5 surgery that is touted over the internet by some practices and leaders in the area. We believe that every French Bulldog and Pug who considers this surgery should have the procedure customized for them. So if they have saccules, if you've heard of saccules in the larynx, they should be removed if they're obstructing more than half of the airway, for example. So each animal that comes to us to get airway surgery has a totally customized approach. We don't just stick to a 5 out of 5 approach. For example, we personalize what each animal has to make sure that they have the best outcome after surgery, because that's what we want as vets at the end of the day, for our patients to have really great outcomes and a reduced risk of something terrible happening, like passing away on a particularly stuffy day. If you're not sure about whether your French Bulldog or Pug, other brachycephalic dog, requires airway surgery or some kind of intervention, feel free to look in the link below where there's a link to book a free breathing assessment with me. I do them all myself, and we've also recently just generated a quiz that asks you as the pet owner a series of questions about the symptoms that your pet may have, and then it scores each answer to the question. And based on an algorithm at the end, it tells you whether your pet will be very low risk, medium risk, high risk, very high risk, and whether you should go and make the next step, which is to make a free breathing assessment with me, so we can work out if your pet is indeed a candidate for surgery to improve the length and quality of their life.